I was working, I was taping the show, but I was having trouble swallowing. I was unsteady. I'm noticing weakness and I'm stumbling, and my voice was a little bit, I was dysarthric, which means that you have a tough time like enunciating. I think there's a lot more people that are getting strokes at a younger age.
So Dr. Pimple Popper had a stroke. I'm Dr. Frita. I'm a board-certified kidney and high blood pressure doctor, and I want to talk about it. Let's talk about the fact that younger and younger adults are actually getting strokes. I'll give you the definition of a stroke. We'll talk about the difference between a stroke and a mini stroke, or TIA. We'll discuss the risk factors, and very importantly, I'll give you the warning signs of a stroke you should never ignore. So Dr. Pimple Popper, actually Dr. Sandra Lee, is a very famous dermatologist for her show, Dr. Pimple Popper. She looks young, healthy, she's super intelligent, she's a doctor, and she still had a stroke. So I really appreciate her for being open about this. According to the CDC, younger and younger adults are getting strokes. In fact, adults between the ages of 18 and 44 have had an increase in strokes by 14.6% over a matter of just a couple of years. So it's pretty serious. What exactly is a stroke, or a CVA, cerebrovascular accident? Well, it's when a portion of your brain actually passes away due to improper blood flow. There are two main types of strokes. There's an ischemic stroke, which is what Dr. Pimple Popper had. Ischemic strokes are the most common. They account for about 87% of strokes, and they occur when there is an outright blockage of the blood flow to a portion of the brain. So if you have a plaque or atherosclerosis and it's blocking the blood flow, then that part of the brain that's not getting the proper blood flow will pass away and you have a stroke. The other type of stroke is a hemorrhagic stroke, or a brain bleed. This occurs in about 13% of the cases. And it is when the blood vessel supplying the brain actually bursts, oftentimes due to high blood pressure. And so you have a lot of bleeding in the brain, but the portion of the brain is not getting adequate blood supply. And so still that portion of the brain passes away. You may have also heard people refer to mini strokes, or TIAs. These are transient ischemic attacks. They occur when there is a blockage to the blood flow, but then that blockage is temporary. So there might be a plaque that gets stuck in an artery, and you might even start to get symptoms of a stroke, but then perhaps the blood flow allows that plaque to push on through. And so it's just a temporary blockage, transient. A major risk factor for strokes is high blood pressure, or hypertension. About half of the adults in the United States have high blood pressure, and most do not even have it under control. And Dr. Sandra Lee admits that her high blood pressure was not under good control. Other risk factors include high cholesterol. Dr. Lee says that her cholesterol was not under great control. Stress. She says that she was stressed. Smoking cigarettes is a risk factor. Diabetes, living with obesity, doing certain illegal substances like white powder, riding the white pony. It's important to recognize the warning signs and symptoms of a stroke, and please do not ignore them. Dr. Pimple Popper admits that she tried to ignore her symptoms initially. Remember to be fast. If you have B, balance issues, E, eye trouble or blurry vision, F, facial drooping or facial weakness, A, arm weakness or leg weakness, especially on one side over the other, S, slurred speech or strange speech, then T is time to call 911. Time is brain. The longer it takes for you to call 911 or go to the hospital, the more likely you'll have permanent damage, or that you might not even make it. If you enjoy evidence-based medical information like this, I've got it in spades. Give me a follow and subscribe.